Hello, you're welcome to my platform. I am Dr. Sandra and I'm a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about a Pott's Puffy tumor. A Pott's Puffy tumor is a condition that is characterized by a collection of pus below the periosteum that covers your frontal bone, the bone of your forehead. A periosteum, by the way, is a tough sheath. Think of it as a polythene that covers the surfaces of bones. When pus collects below the sheath that covers the frontal bone, that is the bone of your forehead, the condition is called a Pott's Puffy tumor. The Pott's Puffy tumor is commonly due to chronic sinusitis. Chronic sinusitis, by the way, is the long-standing inflammation, that is irritation, of the spaces that are within your nose and head. And these spaces are called the paranasal sinuses. The paranasal sinuses, by the way, are 4 in number, and they include the frontal sinus, ethmoidal sinus, maxillary sinus, and the sphenoid sinus. The Pott's Puffy tumor, however, is most common in individuals that have chronic frontal sinusitis. That is the long-standing inflammation or irritation of the frontal sinuses. The second most common cause of a Pott's Puffy tumor is trauma to the head, and this can result into collection of blood below the sheath that covers the surfaces of the bones of the head. This blood can later become infected by germs, for example bacteria, and there can be pus formation. The other cause is chronic suppurative otitis media, that is a long-standing ear infection, specifically the infection of the middle part of the ear, and it can also result into formation of pus. Other causes include tooth infection, insect bites, and cocaine abuse. In a context where the Pott's Puffy tumor is caused by chronic sinusitis, germs, for example bacteria, can enter into the frontal sinus, and this can cause a recruitment of the cells of the immune system, specifically the macrophages, and the macrophages have some structures within them called lysosomes, and these lysosomes contain enzymes, and once these enzymes have been produced, they cause the conversion of the tissues within the frontal sinuses into liquid form, and this can result into formation of pus in the frontal sinus. There is a build-up of pus in the frontal sinus, and this can result into the spread of the infection into the frontal bone, the bone of your forehead. The infection can spread below the sheath that overlies the frontal bone, the bone of your forehead, as well as the other bones of the head, and it can find its way into the cranium, the space where the brain and its coverings are housed. The individuals that are commonly affected by Pott's Puffy tumor include the teenagers, although this condition can also happen in individuals of other age groups, individuals that have diabetes mellitus, individuals that have kidney failure, and individuals that have aplastic anemia. The signs and symptoms of a Pott's Puffy tumor include a forehead swelling that is tender, painful, and warm. This is actually a telltale sign of the Pott's Puffy tumor, and majority of the time this swelling is above the bridge of the nose and between the inner aspects of the eyebrows. The affected individuals can also present with fevers, headaches, a nose drainage, proptosis, that is bulging of the eyes. There will also be pain emanating from the area of the frontal sinuses. The frontal sinuses, by the way, are located above the bridge of the nose and along the inner aspects of the eyebrows. There will also be tenderness when you touch the area of the frontal sinuses. That means when you touch that area above the bridge of the nose and along the inner aspects of the eyebrows, pain will be emanating from that area. There will also be self-repeating scalp edema. This means that the scalp will be swollen, and when you press the scalp with your finger will leave a dent. The affected individuals will also experience drowsiness and convulsions. The complications of a Pott's Puffy tumor include osteomyelitis, that is bone infection, and this is common in the frontal bone, the bone of your forehead. The infection can as well spread into the space that houses your brain, and this can cause collection of pus in that space, and we can get complications like the epidural abscess, subdural abscess, or collection of pus in the brain tissue itself. The other complication is meningitis, that is the inflammation or irritation of the coverings of the brain and the spinal cord. There can also be a condition called intracranial hemorrhage, where there is bleeding in the space that houses your brain. Other complications can include cavernous sinus thrombosis, duodenal sinus thrombosis, orbitocellulitis, and sepsis. The investigations that we carry out in Pott's Puffy tumor include a complete blood count, ESR, skull X-ray, and a head CT scan. When it comes to the treatment of the Pott's Puffy tumor, the abscess must be drained, and this is usually done under general anesthesia. Early drainage of the abscess is very important because this can prevent the spread of infection into the space that houses the brain. We also employ intravenous broad-spectrum antibiotics for 6 weeks. This ensures that the abscess does not recur after it has been drained. In a setting where there is osteomyelitis, that is bone infection, in this context, infection of any of the bones of your head and subsequent death of those bones, the dead bones have to be removed. The other surgical interventions that we can employ include the functional endoscopic sinus surgery. This procedure helps to widen the drainage pathways of the sinuses, and this can help the pus and the mucus to drain out of the sinuses. We can also employ the frontal sinus obliteration surgery, where we remove the entire frontal sinus, and this can prevent the risk of chronic infection. In a setting where the infection has spread into the cranium, that is the space that houses your brain and its coverings, we do a procedure called craniotomy. This procedure employs holes. We put holes in your skull, and then we can access the pus collection in the space that houses your brain. We can also employ a procedure called trephination. During trephination, we put holes in your skull, and this can help relieve the pressure on your brain that is caused by collection of pus in the space that houses your brain and its coverings. When it comes to the prevention of the Pott's Puffy tumor, please keep an eye on your sinusitis symptoms. If you have frequent symptoms of sinus infections, for example, headaches, fevers, thick nasal discharges, please seek medical attention. This is because majority of the cases of the Pott's Puffy tumor are caused by chronic sinusitis. Early treatment of the sinusitis can help prevent the Pott's Puffy tumor. Please also protect yourself from insect bites, and this can be done by using insect repellents, especially if you're outdoors. Insect bites, by the way, can also predispose you to the Pott's Puffy tumor. Please also visit your dentist regularly, as some oral infections can also cause Pott's Puffy tumor. The dentist can help intervene timely, and this can prevent the Pott's Puffy tumor. The dentist will do regular dental cleanings and checkups, and this can help prevent the Pott's Puffy tumor. Please also avoid trauma to your head, especially if you're playing contact sports or if you're using a motorbike on the road. That is what I had for you. Thank you so much for watching. Please share my videos and also subscribe. See you in my next video. Bye.